Hello, everybody. Just let me pin my comment and we'll get started. I was about to say happy Friday, but we're not. Yeah, I wish it was Friday. I'm so tired. How's it going? All right. Comment posted. Comment pinned. All right. Now that we did that, I could get started. So I'm actually excited to talk about today's topic. So it's really centered around, for those people who have been vaccinated, what's next? What should they do? What is the protocol? And so I'll be providing some recommendations that was offered by the CDC that went out actually yesterday. So before we get started, I want to introduce myself again. I'm David Wilson, social media influencer. Sorry, someone was calling. And I been doing this for the past few months. My pronouns are he, him, his. Hey everybody, I'm getting a couple folks joining in. So Whitman-Walker's Community Health Department has expanded its outreach efforts to social media, which is why I'm here today. So we cover various topics about HIV, STI, sexual health practices, access to care, social determinants of health, and general public health interventions. Our series of outreach sessions also focus on the current pandemic, COVID-19, and ways to manage your sexual health, personal and mental health. The community health team is always here to educate and support you. So today's topic is actually about, again, the new update we got from the CDC that provides information for those people who have been fully vaccinated. And that was air quotes. Sorry, I was off screen. Air quotes, fully vaccinated. So in the United States, over 90 million doses of the COVID-19 vaccine have been administered. About 31 million people have been fully vaccinated in the United States, which brings the fully vaccinated population in the United States at around like 9.4%. In Washington, D.C., there have been over 230,000 doses of the vaccine given, with over 82,000 folks who have been fully vaccinated. That brings the district's fully vaccinated population to nearly 12%. We still have a long way to go, but there's progress being made. Just a few weeks ago, we were at like 8% in the district. So now we're at 12, which means more and more people are getting vaccinated. I definitely encourage you to consider getting vaccinated. So you can visit vaccinate.dc.gov and see if you're one of those people that are eligible for a vaccination at this time. So let's say that you are one of the folks who have been fully vaccinated. I'm sure you've asked, what now? What do I do? What can I do? What can't I do? Well, yesterday, CDC announced some guidelines for those of us who are fully vaccinated. I actually just received my second dose of the vaccine today. So technically, I'm not fully vaccinated. I know that probably is confusing. I did get my second dose, but we'll talk more later in this session about what it means to be fully vaccinated. So, the CDC announced those guidelines for those of us who are fully vaccinated. And the short story is that there are some things that people who have been fully vaccinated can start doing again. And these are some of the things that they've had to stop doing because of the pandemic. So that is some good news there. But the real story is that we are still learning a lot more about how vaccines will affect the spread of COVID-19. And even after you've been fully vaccinated against COVID-19, you should still keep precautions in public spaces, like wearing your mask, staying 6 feet apart, and avoiding large crowds and avoid poorly ventilated spaces until we know more about these vaccines. So Let's talk about what the definition of fully vaccinated means. Again, I just received my second dose of the Moderna vaccine today, but technically, though I received that dose today, I'm not considered fully vaccinated yet. So, people who are considered fully vaccinated, bear with me here. So 2 weeks after their second dose in a 2-dose series. So, like I said, I received my first dose a month ago. I got my second dose today, but I'm still not considered fully vaccinated because it hasn't been 2 weeks since I've received my vaccination. So I have to wait 14 days before I can be in that fully vaccinated population, meaning that there takes a little bit of time for the vaccine to get in our systems and create those antibodies and work its magic. So I'm not fully vaccinated yet, though I've received the vaccine today. 2 weeks from now, everything goes well, I'll be fully vaccinated. So the 2-dose series includes those vaccines. That's the Pfizer vaccine and the Moderna vaccines. And so for the single dose vaccine, it's the same. You have to wait 2 weeks after you've received that single dose. And that's for the Johnson & Johnson's Janssen vaccine. So if it has been less than 2 weeks since your second shot or that initial 1-dose vaccine shot, you're not fully protected, and therefore are not yet considered fully vaccinated. So continue to take all your precautions and the steps that you need to or have to until you are fully vaccinated, meaning that you've had that 2-week incubation period. So, probably not incubation, not the right word, but you get what I'm saying. Now, for those of you who do meet that definition of being fully vaccinated, meaning that you've got all of your doses of your vaccine, whichever one that may be, the 1 dose or the 2 dose, and that you've waited that 2-week period, and now you're fully vaccinated. Let's talk about what has changed for you. If you've been fully vaccinated, that means you can gather indoors with other fully vaccinated people without wearing a mask. Again, if you have been fully vaccinated, meaning that you've got those doses, you've waited the 2 weeks, you can gather indoors with fully vaccinated people without wearing a mask. You can also gather indoors with unvaccinated people from one other household. For example, if you're visiting your relatives who all live together, you can visit those people without masks unless any of those people or anyone that live in that household has an increased risk to a severe illness. So if there's a person in that household that has an increased risk of severe illness from COVID-19, you should continue to practice all the precautions that we tell unvaccinated people to practice. Also, if you've been around someone who has COVID-19, if you are fully vaccinated, you do not need to stay away from others or get tested unless you actually have symptoms. All right, repeat that one for you. If you have been fully vaccinated and you come or been around people or person who has COVID-19, you do not need to stay away from other folks or get tested unless you have symptoms. Of course, you should still wear your mask. You should still practice 6 feet of social distancing. You should avoid large crowds, all of that. But it's not, you don't have to go into the quarantine period if you were not vaccinated. However, if you live in a group setting, meaning you live in a group home, you live in a nursing home, or you work in a nursing home, like a correctional facility or detention facility, or you're around someone who has COVID-19, you should still stay away from others for 14 days and get tested if you don't have symptoms. That's if you live in a group setting, meaning that you live with a bunch of others. You should take those precautions just to make sure that you don't potentially spread the illness to any others. So, any questions about that? Feel free to drop them in the comments. Those are the CDC recommendations as of now that have changed for people who have been fully vaccinated. Obviously, there are some benefits there the people who have been fully vaccinated have a little more flexibility in their daily lives now. So good news for those of you who have been vaccinated or fully vaccinated or plan to be fully vaccinated. But let's talk about what has not changed, because there's still a lot that even a fully vaccinated person should consider. You should still take steps to protect yourself and others in many situations, like wearing a mask, staying 6 feet apart, avoiding large crowds, and poorly ventilated spaces. You should definitely take precautions anytime you're in public. If you're gathering with unvaccinated people from more than one household. Also, if you are visiting an unvaccinated person who is at an increased risk of severe illness or death from COVID-19, or who lives with a person who's at an increased risk. All right, so you should still avoid medium or large size gatherings, even if you are fully vaccinated. You should still delay travel. That includes domestic and international. If you do travel, you'll still need to follow the CDC requirements and recommendations for travel. Also, you should still watch out for your symptoms. So even though you're fully vaccinated, there's still things that we are learning about the vaccine. So still keep an eye out for COVID-19 symptoms, especially if you've been around someone else who is sick. If you have symptoms of COVID-19, you should get tested and stay home and away from others, just like we prescribe or recommend for anyone else. Also, you will still need to follow whatever guidance that is provided at your workplace, whether that's at the state level or those recommendations provided by the CDC. So you still have to follow those guidance. And I know some of the guidance can vary from state to state, city to city. But keep in mind, we have CDC recommendations and then we have the other stuff. So I encourage everybody to follow the CDC recommendations, and you can definitely find that on the CDC website. Also, I mentioned that we are still learning more about the COVID-19 vaccines and the effect that might have on the spread of COVID-19. But I guess I want to be a little more explicit in what we know and what we are still attempting to understand. We do know that COVID-19 vaccines are effective at preventing COVID-19 disease, especially severe illness and death. We're still learning how effective the vaccines are against variants of the virus that causes COVID-19. So I know you probably heard in the news there are new variants that have been introduced into the U.S. And so there isn't enough data or enough understanding now to actually say how effective the current vaccines we have are with those different variants. Early data does show that the vaccines may work against some variants, but could be less effective against others. We're still learning more. Want to be very transparent. We don't know everything about, how that impacts there, but we're still learning. All right. We do know that other prevention steps help stop the spread of COVID-19 and that these steps are still important. Even as these vaccines are being distributed, we still have to take those precautions I mentioned earlier, staying 6 feet apart, wearing your mask, avoiding large crowds. Those things are still important. We are still learning how well COVID-19 vaccines keep people from spreading the disease. Early data does show that the vaccines may help keep people from spreading COVID-19, but we are still learning more as more people get vaccinated. For example, we're still learning how long COVID-19 vaccines can protect people. We don't really know that yet. As we know more, CDC plans to continue to update their recommendations for both vaccinated and unvaccinated people. So I encourage you all to continue checking the CDC website. Stay tuned on Whitman-Walker's website because we are providing information as we learn. Until we know more about these questions, everyone, even people who've had their vaccine, should continue to take those basic prevention steps when recommended, and especially wash your hands. So continue to do that. I'm just curious. I've said a lot about, those CDC recommendations for those fully vaccinated. I'm curious if you have not received the vaccine or a single dose, a dose? Are you planning on getting it? Does, the CDC guidelines for fully vaccinated people help motivate you to consider that vaccine more than it did before? I'm a little bit excited, receiving my second dose of the vaccine today, that in 2 weeks, I can hang around other vaccinated people, fully vaccinated people without a mask. And so that does open, up for a little bit of socializing. And so, I'm super excited about that. But I'm curious to know if you have some input. Please put it in the comments. What do you all think about the updates the CDC provided? And are you planning to get fully vaccinated? All right. So I don't see any comments in the chat. Yeah, I agree. There are huge incentives to getting fully vaccinated, so please consider it. And yes, masks are here to stay for a bit. So thanks, Brendan. I do want to remind you all that Whitman-Walker is open for free HIV, STI testing. That is by appointment at our Liz location on the corner of 14th Street and R Street Northwest, and at our Max Robinson Center location in Anacostia on the corner of MLK Jr. Avenue and Chicago Street, that is in Southeast. To make an appointment, you can call 202-797-4439. Also, as I said earlier, social distancing is still the best way to reduce the amount of COVID-19 community transmission, meaning that you must continue to create that physical 6 feet distance of space between people to avoid spreading the illness. That also includes wearing a mask in public, avoiding large crowds, encouraging work from home if that is possible for you. Speak with your loved ones over FaceTime and, whatever, Zoom. Continue to social distance because it is a way to care for your community right now. And it's one of the best ways and to do that, So also remember to wash your hands, but also remember to follow us on Instagram, Facebook, Twitter at Whitman-Walker, and at Real Talk DC _ to stay up to date with all things Whitman-Walker Health. I want to thank you all for following, listening. Again, I encourage you all to become fully vaccinated. There are some, privileges and benefits that you get based off the CDC recommendations and guidelines that was provided yesterday. So if you happen to miss the beginning of my discussion, you can go to the CDC's website and review those guidelines. But I'm thanking you all for staying tuned and have a good day.